I'm Gina Lagomarcino. I am our CEO here at Results for Development, and I'm really delighted to see so many of you here today. Welcome. To those of you who are here in the room, I also understand we have a number of people that are dialing in remotely. So thank you all for being here today. So R4D, our mission is to support change agents who are building strong systems for health, education, and nutrition. So as you might imagine, early childhood development is a topic that is of deep interest to us because it actually spans all three of those sectors. And one of the ways we've been trying to support our partner change agents with building stronger systems for ECD is to help them develop stronger workforces for early childhood programs. We are excited that so many countries are now expanding programs for early childhood, and we know that those programs will be even stronger and children will flourish more if they have well-supported workforces. So we are absolutely delighted to co-lead the Early Childhood Workforce Initiative with the International Step by Step Association, and welcome to our partners at ISSA. We spent the last 2 days, as many of you know, bringing together ISSA and R4D brought together a group of 22 policymakers and program managers from, I believe, 9 different countries that spanned the globe, Africa, Asia, Latin America, Europe, all coming together to really share challenges that everyone is facing in developing the workforce for early childhood, and figuring out solutions, learning from each other, developing new knowledge. And I understand it was a great couple of days. So really welcome to all of those of you who traveled very far to be here. We were also joined by a number of friends from other organizations who are committed to ECD, who participated as well, including our 3 funders, Elma Philanthropies, Open Society Foundation, and Bernard Van Leer Foundation. We're really grateful to those 3 funders for funding this work on the Early Childhood Workforce Initiative. And we're hoping that this week is really the beginning of hopefully multiple opportunities for this group of people to get together and continue to share and spread lessons learned around the world. So this morning, we have a great opportunity to expand the group and bring in additional folks, including myself. I'm very excited to be here, who are committed to and really interested in early childhood development, to learn more about what has been discussed over the last few days, to learn from 4 different country experiences, again, that span the globe. I think we've got Ethiopia, Kenya, Sri Lanka, and the Philippines all represented on our panel today. We're going to learn more about some of the challenges they're facing with building the early childhood workforce, and what they're doing to support change and improvements there. So hopefully there'll be some great lessons learned. So I am now going to turn it over to our wonderful moderator, who is Tressa Johnson, the Director of Education at Elma Philanthropies, and she's going to moderate the discussion and introduce the panel. Thanks.
Great, thank you, Gina, and welcome, everyone. I wanted to get right to introductions of our panel. As Gina mentioned, we are extremely privileged to have with us senior government representatives from 4 different countries this morning, who work all day, every day on issues related to the early childhood workforce in their countries. And they very graciously agreed to talk to us about some of the challenges and opportunities they've been facing. So with us this morning, we have Mr. Johannes Wodajo, Director of the School Improvement Directorate for the Ministry of Education in Ethiopia. And then we also have Dr. Teresita Inciong, Executive Director of the Early Childhood Care and Development Council in the Philippines. We have Mr. Kennedy Orunjo, Director of Public Health and Sanitation for Siaya County in Kenya. And then as well, Mrs. Niana Senarate, Director of the Children's Secretariat in Sri Lanka. And I really want us to have enough time to hear from our panelists. And so Gina made several introductory remarks, and I don't want to repeat them, but just to say it's really been a global effort that R4D and ISSA have been leading, and they've produced quite a bit of analytical products on the early childhood workforce globally, as well as sort of global public goods, and that's been part of the effort. But the other part of the effort really has been to engage with teams on the ground in countries who are working with some of these tricky challenges and themes and issues. And that's been incredibly exciting. And over the past few days, we've all gotten together. And as they said, it's 9 countries were able to make it. They've worked with many more during this initiative. And we really had the chance to talk about the ins and outs and sort of the details, really getting into the weeds of what happens in the different parts of an early childhood workforce. So this morning we thought we'd talk about some of the common themes that they see, the common challenges. So we thought we'd start with a warm-up question for each panelist is going to answer the same question briefly in just a couple minutes, and then we'll get more into the details. But our warm-up question is, if you could tell us what is the most pressing challenge facing early childhood workers in your country in just a couple minutes each. And let's start with Johannes.
All right. Thank you so much. Of course, I'm not confident enough to just to explain about Ethiopian pre-primary education subsector because I don't believe that it might be exemplary for other country because pre-primary in Ethiopia is very emerging subsector. We start pre-primary education as a governmentally funded program before 6-7 years ago. However, we brought significant change within this short period of time. The gross enrollment rate for pre-primary education rise up from 5% to 45% within the last only 6-7 years, only 6 and 7 years. Even if a tremendous achievement has been recorded in the country, still some challenges are persistent. The first one, the issue of access, it is unfinished agenda because more than 55% of right school age children for pre-primary education is out of the early learning intervention. The other one, the issue of equity, as Ethiopia is a very large country with a population of 110 million, with different demographic context, ethnic background, and the like. The issue of equity is very critical challenge. The third one is the issue of quality. It is very challenging. When I come to the question raised by our moderator about what challenges are currently experiencing the pre-primary education workforce, like I want to say more about pre-primary school teachers. When we come to pre-primary school teacher, as I said earlier, it is very emerging subsector. Therefore, it was very difficult to get qualified professional for the system because school age children for this age group is around 7.8 million. Therefore, in order to absorb these 7.8 million children to the school, we require at least 100,000 teachers. Therefore, within a short period of time, it was very difficult for us to produce those 100,000 teachers. Therefore, we obliged to recruit volunteers and existing primary school teachers and also secondary school graduate with a short, short-term training, like 1 month, 2 weeks, and the like. Therefore, for the last 6-7 years, what we experienced on those workforce is the first one, it is the issue of incentivizing those volunteers. Volunteers, they were motivated by themselves, but they require some sort of salary. However, the government couldn't afford adequate money for them. Therefore, the issue of sustainability was a question for those volunteers. The other one, just those preschool teachers supposed to be preschool teachers, but they were not preschool teachers because they were not qualified with at least 3 years diploma program. Therefore, one of the challenges we experienced on them is because of their knowledge and the skill is very minimal to take care on children. Most of the parents were very disappointing by the school experience because when the children come to the schools because they are at age 4, at age 5, no need of expecting to read and write, especially to write, spelling, and the like. But teachers, because of the poor knowledge, the poor skills, how can they handle those children? They obliged those children at age 4 and 5 to read and write by using pen or pencils. That might have also strong impact on the psychomotor development. the motor, the fiber will be impossible even to hand over the pen or the pencil. Therefore, parents in some cases they are blaming on the education system because of the poor knowledge and the skill of our preschool teacher. The other one, the issue of coordination was very poor because for one child we need protection, we need care, we need nutrition, and also early learning stimulation. In that case, we of course we used in our cases we have health extension worker in every village, and they are supposed to coach, mentor the schools on how the preschool teachers and the volunteers handling that those children. But we found it very difficult, the coordination between health sector and the education sector and the other even social protection sectors too. Therefore, the issue of coordination was very challenging. Maybe I will come, how can we overcome those challenges and the like?
Can I stop you and go to the, and we'll come back to you, don't worry. Dr. Teresita, do you want to talk a little bit, Johannes raised quite a number of challenges. Do you want to talk a little bit, just a couple minutes on the most pressing challenge for early childhood workers in the Philippines?
Yes, thank you. The most pressing challenges of the workforce in early education in the Philippines at the moment is the centralized nature of our government. Based on another law, the local government takes the burden or responsibility of taking care of the very young children in each cities and municipalities. And these workforce, the early childhood educators, both teachers and workers, do not receive really salary. And it depends upon the capacity of each city and government or city and towns to be able to pay that workforce. So I think I'll stop there because I would have to.
Okay, Kennedy.
Thank you very much. I believe in the Kenyan context, especially the Siaya County where I come from, the most pressing challenge is we lack clear guidelines on how to be able to support especially career development of these home visitors. In Kenya, we refer to them as community health volunteers. So they are put within a volunteer program. So if at all we could get a clear guideline and structures on how they can also, of course, have career development into particular stages whereby they're also protected by certain policies and laws, then that could be a very good grid for them to be able to offer great care and services on nurturing care, especially at household level. Yeah.
Okay, great.
First of all, I should thank you for inviting for us for the discussion. As common as most of the countries in Sri Lanka also, I'm especially referring to the ECD workforce. That means the center-based early childhood development. The lack of opportunities for that professional development is the most pressing problem. Because there are quite a number of professionally not the teachers that they haven't got the professional the knowledge for the preschool education. Still, they are existing in the system. So that is the most present challenge in Sri Lanka as well.
Great, thank you. So just in these short answers, I think we've surfaced a lot of the issues we've talked about over the past couple of days, and some of them are specific workforce issues, but some of them I just heard are actually the workforce is situated in a larger framework and government policy environment, and some of them are affected very heavily by the policy framework around it, sort of the intersectoral coordination and the decentralization. So with that, let's talk a little bit more in depth about some of those issues. And Johannes, you were starting to tell us about scale. As you mentioned, Ethiopia is an incredibly large country. We're talking about 100,000 teachers, millions of children, and yet you've gone from 5 to 45%, and I know the plans are 100. Can you tell us more about how you're ensuring, as you mentioned, those teachers, many of them are not yet qualified, but they're going through training, how you're ensuring that they're well qualified and using play-based methodologies? Can you tell us more about that?
Yeah, thank you. When we come to the issue of teacher, of course the question is very critical, and it was also very challenging for the education sector to answer the issue of teacher. Before 5 years ago, uh, what we have done is already we established all-class program in all of our primary school. The all-class program means it's a program delivered for only for 6 years old children, and the objective is to stimulate, initiate, and motivate them to make them ready for grade one. It is only a 1 year program, and when we start this program, we require more than 100,000 teachers. However, it is as I said earlier, it's very difficult to produce 100,000 teachers with the only 7 college of teacher education charged to train pre-primary education teachers. Therefore, what we deploy by using the existing primary school teachers and giving a 1 month short-term training. We tried to equip those primary school teachers to make them ready for all-class teacher. Therefore, around 50,000 teachers were trained with short-term 1 month training during summer program, which is mostly the school is closed at that time. Therefore, we established 5 center of excellence universities only to train those 50,000 teachers. And in the last 2 3 years already we trained them, deployed them, and we gave some sort of incentive for those teachers. Meanwhile, we are also working on scaling up teacher training system. We had only 7 college of teacher education, which was charged for to train pre-primary education teachers, but we scale up this pre-primary education training system in all our 47 college of teacher education, and currently all of them deployed to train a 3 years diploma program as well as a 1 year certificate program for pre-primary school teachers. Therefore, we alleviate the shortage of teachers with 3 mechanisms. The first one, by using existing primary school teachers with giving a short-term 1 month training. Then the second one, by using our College of Teacher Education, a 1 year certificate program. And the third one, which was supposed to reach, is a 3 years diploma program, which was also offered by College of Teacher Education. In the other case, for those College of Teacher Education, teacher educator also trained by 5 center of excellence universities. Then we deploy this kind of strategy and mechanism to alleviate the issue of teachers, the shortage of teachers.
Great. And do others who are working on the issue of early childhood educators, Dr. Teresita and Niranya, do you have similar thoughts about how you're working to qualify your teachers?
Well, the new law which is the Republic Act calls for really professionalization of teachers, and it really calls teachers, early childhood education teachers, because of the critical period of education development. However, at the moment when we started, the ECCD program in the Philippines started as early as 1964. But for several decades, it has been only one of like a minding center. But since 2000, when there was this law, it becomes very, very important that we have to train the teachers handling very, very young children, because this is the way it should be. So what happened is that out of the 50,000 child development workers, only 25%, and rather 50%, which is 25,000, are with degree but not necessarily in education. And therefore, there's a critical need to really, really train them. So now when this new law, which has been enacted in 2013, we started coming up with a new quality kind of access. Like we established a National Child Development Center, and it's a model center. And at least we are aiming for one per cities and municipalities, and it is something like 1,634. At the moment, up to 2019, where we will be able to establish at least 800. And therefore, we're talking of 800 degree holder in early childhood education. And on top of that, we already have developed our own curriculum and our own standards. And those who are not yet degree holder, we made sure that the child development teachers, which we have given scholarship, are the ones who are training them. In a way, we're educating not only the teachers who are, the daycare workers who have been there for quite some time, and they do not have that pedagogical principles, which is supposed to be equipped with, they're supposed to be equipped with that. But we are also educating the parents. So we have a family support system so that children who are not able to go to the center are also trained by their parents at home. So that's where we are at the moment. And some of we have volunteers. We have barangay nutrition scholar who are also trained and are together with other teachers in the center. They are serving as teacher aid.
So it sounds like no matter whether you're a country who's just starting to attempt to train enough primary teachers or a country who's been doing it for quite a while, there are some real challenges associated with training teachers for the youngest children, and that it's actually a different content, different quality, because it's so play-based.
Right.
And so intersectoral. You both mentioned health and nutrition as incredibly important for these youngest children.
Actually, for the Philippines, it's the law calls for an integrated services, health, nutrition, early education, and social services all together.
All
It should be
together.
comprehensive.
All together to make it more challenging.
Right.
So let's move to the Philippines. And you're executive director of the Early Childhood Care and Development Council, which is a little bit of an unusual body that we don't see in a lot of other countries. So tell us what that is and why it was formed and how it works.
It's a long journey insofar as early childhood education is concerned in the Philippines. Before, it was only handled by the department, meaning the Ministry of Social Welfare and Development. But then it was focused only on minding the children, so that the children are in the center while the mothers or the fathers are working. However, we started when the new law was passed. The state is mandated to provide early childhood education from 0 to 4, which is very, very new. And then what we did is that there are two sets of structure that has been formed. One is the governing council, which is composed of 7 members, and I serve as the vice chairperson. And then we have also the local governments, which we established as something like the ECCD committee down. The governing board is composed of the Minister of Education, who is the ex officio chair. I serve as the vice chairperson. The Minister of Health, Social Welfare, National Nutrition Council, and then the Union of Local Authorities of the Philippines. And we have one representative of the private education, the private sector, which is an expert in early childhood education. So this we have. Then the function of this council is to prepare policies and standards, programs, ensure that technical support are given to the field, and of course making sure that there are innovation, research in terms of early childhood education. And these are before it used to be the old council is composed of 11, but it's very difficult to manage 11 ministers who are not always there. So the 7 members now is quite working very well.
Okay. And it sounds like it's working better, 11 to 7. But I imagine there are still some challenges with that intersectoral piece.
There is, because each department, each ministry has its own mandate. And definitely, while they have a line budget for early childhood education, it competes with each other. And not everyone will be willing to give up for their own money for quite some time. That's one. Two, we also have to connect with the local government who is in charge of providing basic services in the field. And therefore, the secretariat, which I had, has not enough tool to be able to make them, to be able to let them follow the law, where they comply with the law as far as to the extent that, but the ECCD is usually the lower priority at the moment. And culturally, some of the parents are not yet sold to bringing in very young children into the center. So that's one of the challenges our early childhood education educators are facing.
And tell us a little bit about how Philippines has worked to make sure that being an early childhood educator in these centers is a viable career option.
For early childhood educator? Well, at the moment, as I said earlier, it's a low priority in terms of the local government. But in several state colleges and universities, they have already offered an early childhood as a specialization. It's a degree by itself, and it requires licensing. And we have we have completed the national standards and competencies for teachers, and therefore it gives, this is the standards that the local government is following. We also have a national standards for the facilities. And again, we have to accredit them. And they also work towards that accreditation because it gives them a leeway for awards from the government.
And do you find that people are choosing this?
Yes,
this
at the
option?
moment there are many because while the ECCD Council is working towards 0 to 4, but the early childhood education program in the Philippines is actually 0 to 8. However, 5 years old is already in the formal school because there's another law, which is the kindergarten law, that mandates the state to provide kindergarten from 5. So there's K to 12, and there's that the 0 to 4 or the ECCD is the foundation and the transition to K. So it works well this time.
Great.
Our curriculum is actually the curriculum, the K is a continuation of the curriculum from 0 to 4, and it is developmentally appropriate in terms of ability, in terms of age, in terms of culture. And it is also inclusive. So all the centers, the teachers are required, not equipped with knowledge to identify children with delays. Then we included children who are indigenous people, children of migrants, children of people in conflict with the law, and so on and so forth. All the marginalized children are the ones that we are focusing more, because those who have, they can always enroll in the high-end kind of early childhood education.
Right. So you were mentioning that there are some areas that have become innovators in this practice, which brings me to Kennedy. And as an official in Siaya County, you all have been leading, not just as a leading county in Kenya, but in some ways a leading entity globally in integrating nurturing care into what you're doing in Siaya County, into your health system for the youngest children. So can you help everyone here understand what nurturing care is and how you've integrated it?
Thank you, Teresa. I think just like has been mentioned much earlier, we had these two departments working with a great gap, that is education, doing only issues to do with education, and of course bringing up the children in that particular cause, and the health were most involved in doing health issues and not really seeing the importance of partnership in, of course, trying to bring up this child. Because I think for a child, the first 1,000 days is very important for a child in the aspect of development and on all forms. And of course, this now called for the need for us to be able to have a kind of partnership in trying to nurture these children towards preparing them to school and also their adulthood. So basically, nurturing care in this sense is about, of course, looking at the first 1,000 days, creating the space for the children to be able to grow in a healthy manner, looking at the aspects of nutrition, and also looking at their cognitive being and the way to make that particular space also grow in the rightful way. As a county in Siaya County, Kenya has 47 counties, and within the 47 counties, Siaya is one of the 47 counties. We took an initiative to be able to champion the aspect of nurturing care. And I think this started from the leadership. There's a time where my county governor, His Excellency the Governor, and a team from Siaya and Kenya came for studies on the child science and nurturing care. And this, of course, made them come back and give us a feedback on the importance of carrying out this particular program and activities. So during that particular time, like I'd explained earlier, education were doing their own things, health were also doing their own things. So it became important for us to get a fulcrum, an area of convergence where we could have all these particular programs running for the benefit of the child, because for the child, he doesn't know about education and health being separate, but the child wants to grow wholesomely in the best interest of the space that they need. So we, of course, came up with a multi-sectoral approach, and this multi-sectoral approach is where we had the county first lady being the patron of nurturing care, and by so I mean all the departments that of course contributed to, of course, the well-being of the child and the growth of the child came together, and they were all doing activities according to the planned activities within the multi-sectoral approach level. So we have education, we have health, we also have agriculture and aspects of nutrition and, of course, food security, and of course other departments coming together to be able to champion the aspect of nurturing care. Within this particular aspect of nurturing care, we are looking at issues of course, identification of delayed milestones within the kids, and of course, the health structure within Siaya is that we have a very important intelligence network to the household level, and this is through community health services. Within the community health services, we have community health volunteers, whom in this case referred to as home visitors, who visit households, and they are assigned particular households within the region. Each community health volunteer is assigned 100 households. So they're able to visit these households and give in key messaging on health. And in this case, because we are, of course, nurturing the aspect of nurturing care, so they also give key messaging on nurturing care to the household levels. Within the 100 households that they look at, there's the aspect of focus and priority on the areas where they deem fit and they require more visitations and follow-ups, and especially to households where we have children of that particular age, children below 5 years, and also children who require, of course, follow-ups on certain aspects so that they're able to grow wholesomely. So within that particular kind of structure, they are supported with other departments through the First Lady's office to be able to offer these services. Yeah.
And one thing we hear about when we talk about community health volunteer systems in any country is that how community health volunteers, they're volunteers usually, and sometimes there are incentives, but they're not usually salaried, and they're usually doing it for a variety of reasons. They're incentivized a little bit by maybe an incentive they get, but also by serving their communities and their families that they live with. But we know that those volunteers have already been asked to talk about HIV, to talk about TB, to talk about nutrition, to talk about infant monitoring and growth, to talk about sanitation and water. Was it an issue? Did you worry at all? How did you handle adding yet another thing to what community health volunteers do? How did that work in CIA?
Of course, I know they take care of different other entities, and they have different other interests based on the disease burden of the county. But we had a seamless kind of linkage to now nurturing care as an aspect, because these community health volunteers visit households with key health messages. And we believe that within the key health messages, you could see even from the indicators that they're looking at, most of them look at key health messages on children under 5, and also households are vulnerable in a sense. For example, a household that is having a mother who is pregnant, a household that, of course, has people who need some other medical care that, like, for example, home-based care that they need to provide as services to that entity. So it became easier for us to be able to also incorporate the aspect of nurturing care, because as they go to the households, they have clear indicators to look at, and within their checklist, one of the things they look at is if there are delayed developmental milestones, if those particular children need stimulation at that particular level, if the caregivers are practicing the parental skills, proper parental skills, and also giving in, of course, space for the kids to be able to grow in the best interest. But then it was an agenda that was conforming to the general work that they used to do. So it became easier for us to be able to instill that. I cannot dispute the fact that they are doing other works that, of course, will at times skew their interest towards the emergence of certain cases and being able to deal with them in a prioritized manner. Though, as a county, we thought of not really letting them be merely volunteers in the sense that they don't really get anything. So we became the first county to, of course, incentivize them by giving them an incentive of about $30 per month, and also to be able to take care of their health insurance, themselves and their families, as an aspect of motivation. And then we also, of course, brought on the aspect of recognition. To them, recognition is more important than remunerating them using money, because, of course, the money won't be enough. But if they are recognized within the community, and the community gives them that particular respect and can be able to listen and put into action the particular key messages that they give to them, then they feel more motivated, and this made it easier for us to again use them, because there are these people who already interacted with the households, and they will be the best people to be able to drive in our agenda of nurturing care.
And have you been able to detect, or have you had feedback from the families with who are being visited by the community health volunteers, and now that what they're doing when they visit the families is a little bit more holistic and a little bit more extends beyond just checking on nutrition and health status? What has been the reaction of the families?
I think the families have been very happy with the particular kind of support that they're getting from community health volunteers in the sense of nurturing care. I believe there are several testimonies that they've given to us this. The kind of engagement with the households that we introduced was a dialogue process. And within the dialogue process, the community health volunteers, of course, initiates a dialogue process with the individuals at household level to be able to get to know where their challenges are, and ultimately help them in coming up with solutions that they can be able to put on board to deal with their problems. I know through, of course, several other dialogue processes that we normally conduct with the community, because as they go to the households and give in these key messages to the household members, they also collect certain data that is key and important for the community. For example, they collect data on the number of children within that particular community that required referral for certain issues. Maybe they have the milestones are not on well as required. Maybe these particular kids require some medical attention or maybe nutritional support interventions. This particular information is collected on a day-to-day basis, a routine basis, and then it's displayed for the community for a community dialogue process. So each and every quarter, that is after every 3 months, the community sits down to look at the data. And from that particular data, if they see the number of children with delayed developmental milestones increasing, then it becomes an issue to the community. And since the introduction of nurturing care, I think the focus has been on the community themselves coming up with actions towards, of course, supporting each other, as opposed to waiting for community health volunteers to come and give them the particular options on how to deal with these particular issues. So the community has become receptive. That is one clear message that can show us that this nurturing care has been instilled within the people. And by being that receptive, they talk freely about nurturing care, and they talk about nurturing care to their peers. So their peers become one of our advocates towards, of course, embracing the aspect of nurturing care. Yeah.
Great. And it's my understanding that CI County has been able to accomplish all of this partly because of the decentralized nature of being able to, of the health governance system in Kenya, and being able to make some of these decisions at a county level and test being able to pay volunteers for the first time and being able to incorporate nurturing care. And so it's really enabled as a CIA as a county to move ahead and test some of these things. And what kind of reaction has there been from other counties in Kenya?
I think currently there are a lot of interests because the other counties are seeing CIA been doing well on aspects of other health indicators, like, for example, being able to monitor the nutrition status of children at that particular age, and also embracing the importance of taking care of kids in the first 1,000 days, and also the introduction of play as an important tool to be able to help children develop in the required manner. So other counties have had interest. I'm with my coordinator here for RMNCIH and the nurturing care process, and we've received requests about, currently as we speak, about 4 counties have visited us. We already have requests for other, maybe 3 or 4 again, who are interested in coming to Bench Park to see how we are running the nurturing care component. Because ideally, in other counties, they have still not thought about the multi-sectoral approach in dealing with certain issues that are societal in nature. For example, they require different other departments, giving in their inputs on how to deal with those situations. So it is something that the counties have embraced. We've also we've been invited severally to other counties to go and talk about nurturing care components and the way this program is being run within Siaya County. We've done that to, I think, 2 counties. The 2 counties are so much interested in, of course, embracing this as an aspect. Kenya currently, as we speak, we are moving towards universal health coverage, and with that particular kind of program being run on a country basis, there's the interest of introduction of nurturing care as a component of that particular package, because within the universal health coverage package that you're looking at in Kenya, we are looking at issues of access, and through the use of community health volunteers, then they can create access to the caregivers and also the mothers to be able to take very good care of their kids. We're also looking at issues of financial risk protection, a part of which the county government of SIA has given priority by starting to pay for their community health volunteers who visit the individuals at the household level to give key messaging on nurturing care. And also we are looking at issues of social accountability, which in real sense, introduction of dialogue processes so that the community members can also have a voice and idea on how to be able to run these particular programs. And this, of course, brings in the aspect of receptiveness of the community through following up the process and also embracing the aspect of nurturing care. And then, of course, we are also looking at, of course, the issue of quality. In this sense, our community health volunteers are taken through the training on nurturing care with a clear curriculum. This particular training embraces the aspect of them being able to give quality of services at household level on nurturing care. So when there's the normal interactions between counties through a peer-to-peer learning exercise, it's normally interesting because the counties are normally eyeing towards listening to what SIA says on nurturing care as a component.
Excellent. I wanted to pick up on this, the trend we're seeing in decentralization that all of you have mentioned, and ask Nayana how this trend towards decentralizing responsibilities for preschool education, how that's working in Sri Lanka, and how you're able to sort of monitor and manage the workforce and quality of workforce in Sri Lanka.
Yeah. In Sri Lanka, also the preschool education, especially the monitoring of the management of preschools, and the preschool registration is decentralized. Those are with the provincial councils of Sri Lanka. There are 9 provincial councils. But the ECCD policy that is governed by all ECCD aspects in Sri Lanka is implemented by the Minister of Women and Child Affairs. So according to the policy, there is a governing body of all ECCD activities in Sri Lanka. That is the National Coordination Committee of Early Childhood Care and Development. The chairperson of that committee is the Secretary of Ministry of Women and Child Affairs, and all the other members who are involved in the ECCD, all ECCD activities like education, health, childcare and protection, and all the private sectors, NGOs, they have identified that the different stakeholders in ECCD, and also the members from those the organizations and the ministries, they represent the Early Childhood Care and Development National Committee. So all the 9 provincial councils, they have established separate entities for the preschool monitoring and regulation. So since it is started in about from 1990s, and the provincial councils, they had to establish as a new system, and it is one of the subject of the provincial council is the preschool registration and the regulation. So now all the 9 provinces, they have established a separate organization or entity or a unit for the regulating the preschool education in those provinces. In some provinces, they have early started like 1990s, and some have established the statutes very close, like 2014. Like so, from 9 provinces, from province to province, the way of the regulating the preschools have a bit similarities. Also, there are differences. So when we take as the national body, the whole 9 provinces, they represent the National Coordination Committee. So with that we can make them committed to follow the national standards and the national curriculums, and what are the nationally that we have introduced to the system. They are there and they are committed because they are representing the National Coordination Committee. So that is there. So if we take the workforce, I should add that since for the whole ECCD activities, there is a separate one policy. but always there is a special attention should be given to the preschool education. So there is another policy on preschool education has been developed, and very recently that is been approved from the Cabinet of the Ministers of Sri Lanka very recently, within maybe before 2-3 weeks before this. So since there is one coordination body should be there for every activities, that from that policy also the governing body of that policy is the same national committee. So I think now all the regulations and the policies are there. But if you take the preschool teachers, the profession, there are about 29,000 preschool teachers and about 7,000 assistants of preschools are there. If we take the entry qualification for the preschool sector as a preschool teacher, the minimum standards have established from the national government, and also the provinces, they have the flexibility of getting adopted that national standards, and they can add some more other things that they have to be included, that they have to be specific the system for the province. So most of the provinces, they have adopted the national the standards. According to the national standards, the entry qualification to the system is if we take the basic educational qualification, that is somewhat similar the junior high school, that is GC ordinary level, and also with that they should possess a professional qualification of 1 year early childhood care and development diploma. But if we take the existing the teachers, there are about 3 to 5% teachers who are not qualified, as they haven't at least the basic educational qualifications. They are below the ordinary that educational level. And also only 33% of teachers, they possess only the professional qualification like 2-year diploma. About 50% of teachers, they have the qualified as 1-year diploma. But there are some, about 33% of teachers, they have only 6 months diploma on ECD, early childhood education. So that the disparities they are within the system. So that we have the responsibility of getting that unqualified teachers to the system, since they are not professionally qualified, they are not aware of the ECD pedagogical systems, and how they don't know how to get how to do child-centered activities in the preschool. So most of them, they are stick into what do you say, the writing and the keeping children sitting on tables and do things like writing and things. So if we want, if that there is a recipe, as the central government, we have the responsibility of getting them into the system, because then we can't fire them or ask them to just stop it and go away. Mm-hmm. So as a solution for that, the central government, now we have a early childhood development project funded by World Bank. So we thought of getting them the basic qualification, what they should know as a preschool teachers, the minimum. So we have specially designed an in-service training program for them, about 7 days training, comprehensive training. So that is given to them free of charge. Also, since they are working under the provincial councils, we make aware the provincial councils, get the teachers to the training, and we have started that training to at least to cover about 50% of the population of the teachers that is there. And if we take the teacher development, the teacher professional, the professional qualification, only one university is having they are conducting the diploma on preschool education. Only one university, that is only a diploma, but there is no degree course or degree program in any of the universities still. So that we are just discussing with the universities to start a degree program, at least basically a diploma program, then go to the degree program, and we have to establish a career pathway to the teachers, that because they can't be teachers forever. I have seen in some countries the preschool teachers, now they are the university professors. That career pathway is there. That should be established. So as a central government, we are also working for that.
Great, thank you. And this is another common theme that we've witnessed over the past few days of when you're quickly trying to expand services for young children, or when you've been doing it for a long time, but there haven't always been the sort of official standards in place, you find you have a workforce, some proportion of which is not actually qualified by the formal standards and qualifications. And so it's a common challenge, it sounds like, to figure out what to do with that 10, 20, 30, 40, 50% of your workforce that doesn't quite meet the qualifications you'd like to see. But how do you sort of quickly or figure out a path to help them attain that qualification? Because you want to retain them. Often they're quite good, they just don't happen to meet the standards. So that's interesting to figure out, to see how Sri Lanka has addressed that. I also wanted to ask you, Nayana, we've largely been talking about public provision of services, of preschool and community health services, but I understand in Sri Lanka a good percentage of preschool is provided by the private sector. So I wanted to just quickly, we're going to wrap up this section and go to questions from the audience. I want to make sure to get to those, but if you could just quickly tell us a bit about how it's been in this system where the majority of preschool provision right now is private sector, and how that works.
Yeah, about 80% of the preschools belongs to the private sector. If you take the private sector, even they are private, they have to register under the provincial councils, the statutes as a preschool. That registration, the provincial councils, they have established a minimum standard, the qualification and the guideline for the registration procedure. So even though they are private sector, they have to come to the minimum standard to get the registration as a preschool. But it is, if we take some provinces, they perform well. There are about 90% of the preschools have been registered under the provincial statutes. But some provinces, they are still they're developing their systems of registration, so that is there. And the other hand, even if the preschool is not registered under the provincial statute, even they can do the preschool. There is no legal provision, or it is very difficult for the provincial councils to get them get them registered to the system. So still we are lack of a proper legal background to that establish the proper regulated system. So now it is proposed to have established Early Childhood Development Act or Preschool Education Act. If that kind of a legal provision is there should be some kind of regulation. But even about 80% of the preschools are under the private sector, that is not a problem of regulating them still, because they are they are governed by the preschool authorities in provinces, and also they are committed to work with the minimum standards and the guidelines given by the central government and also from the provincial government, because most of the in-service training are provided to the teachers free of charge from the government. And also from the government side, there are programs even in the provincial council and from the central government. There are scholarship programs for the teachers to follow their professional their qualification, to get the professional qualification free of charge. So that they are always even if they are in the private sector, they are always with the existing system.
That is system. Great, thank you. We've touched on a number of themes, but I wanted to open it to the audience for questions, and maybe we'll take 3 or 4 questions, and then we'll gather them, and then allow our panelists to answer. Do people have questions? Yes, Sweta.
So hello, my name is Sweta Shah. I'm with the Aga Khan Foundation, and I had a few questions just picking up on the challenges that the 4 of you or the 5 of you raised. One is the challenge of scaling professional development for the early childhood workforce. All of you mentioned the challenge of getting enough people qualified. And so my first question is, we're working right now with the government of Egypt to develop a course which would be something that's online as a minimum, and then online and face-to-face for those localities that can afford to do the face-to-face. And I'm curious to know from your perspective, is that something that you think would be helpful and useful for your governments? And then the second question is, we're also working with a number of partners to do we're piloting one-on-one technical support for government officials such as yourselves to really think through the challenges that you're facing specifically and how to resolve them. And I'm curious to know if that is something that would be useful for your governments. And then I guess in connection to that, sorry, I have one more. You're here together, learning from each other. And I know that the Early Childhood Workforce Initiative is trying to kind of bring you together. There is some discussion with a few other organizations about having a community of practice, which would bring you all together, not only so you can talk to each other, but you can be connected to the latest research on early childhood and what's happening. And so my third question is, would that be useful?
Let's take a few more. That's all right. Let's take a few more over here.
Thank you. Good morning. Katie Vickman with Palladium. I'd be very interested in understanding your viewpoints regarding increasing access to quality early childhood education through supporting the expansion of branches or groups of schools, franchises, or centers that could rapidly offer access to quality education and provide an accountability platform to ensure that standards are being met.
I think there was another one on this side. Yeah.
Hi, I'm Jack Graham, a freelance journalist based in Toronto. I was wondering, as well as the salaries, the way that ministries are set up, the way that qualifications are set up, what you think about the cultural recognition side and what governments can do to get more of a cultural recognition in the country, including, for example, the fact that there are so few men that work in early childhood. So working out the kind of cultural questions and what steps you can take to do that.
All right, do we have any more right now? We'll try and fit in another round, but maybe we'll start with those. And let's start with this last one about cultural recognition and male participation in fields that are sometimes traditionally female. Who wants to talk about that? Dr. Teresita, do you want to talk about that? The questions about how you can promote recognition for men to be involved as workers in these fields. So whether it's as a preschool teacher or a community health worker, but men working with young children, is that already valuable in local culture?
In the Philippines, yes. There are male students in the college, because I also teach in the graduate school, and there are males who are enrolling in the preschool, and they are very good. In fact, the ones that we've been training and have been manning the child development centers that we've been building, there are males, and they work well, especially in areas where they're accepted, because there are also the case of religion, and culture. You would like the very, very young kids, especially young children, to be handled by, of course, by female. But in Metro Manila and Cebu and Davao, they are very well accepted. But the problem with this is after they're being trained, and because there is no salary at the moment, there are no clear-cut salary for an plantilla position of the government, and it depends upon the local government, as I mentioned earlier. So when they are properly trained, they transferred to a more to the more formal school, like the department or the Minister of Education. But they are accepted, yes, and they are very well trained, and they do very well.
Okay, and the last point you were making is that they often move to places where they know there's a
They
salary.
do, yes, sometimes.
Okay. Does anyone else want to answer that particular question? Yeah.
In Sri Lanka, I think it is not about 1% of the male workers in the preschool sector. So it is completely a new thing if we take the Sri Lankan context and the culture. So there are twofold the problem, because we have to see whether parents accept males to be in the sector, and also whether the other side, whether the young males, whether they like to enter this the profession that is there. So it is that revolutionary thing if we are going to start that. But I think it is a very good point to start, and we will see what will happen.
And that's something you're hoping for. You're hoping to work on. Okay, great.
And I think I want to associate myself with the sentiments of my colleagues. And I think in community health workforce, especially, it's a very small percentages are male. And I think it's because of the nature of work that is involved, and the other aspect of volunteerism has been mentioned here. That doesn't mean male do not want to volunteer, but whatever again it means is that there are other aspects that come on board, like culture and acceptability, where the community, especially while because what the campus is talking to the caregivers on aspects of nurturing care, and also in a larger extent also trying to champion the aspect of family planning and these particular key health messages that relate to a particular kind of gender. And we do believe at times peer-to-peer knowledge sharing is key, and also cultural practices. Yeah.
Great, thank you. And we had a question about scaling professional development for early childhood workers. And if I understood correctly, that's not necessarily about the pre-service training. You're talking about in-service and professional development opportunities after initial training?
Either.
Okay.
Pre-service, in-service, just around, helping more people get minimum qualifications.
Do you want to talk a little bit more about that?
But just as I said earlier, we established different training system for. We established different teacher training system, either with the form of pre-service and in-service. And when we come to pre-service, already we established a three program. That is a short-term training, a one year certificate program, and also 3 years diploma program. This is belongs for pre-service program. When we come to in-service, already we implement this with a large scale manner, because in order to fulfill the shortage of teachers, we used the existing primary school teachers. Therefore, those primary school teachers were trained pedagogically for primary school age children. Therefore, they required to know more about child psychology, child development, and other. Therefore, we have a shorter term training during the summer season, which all the school is closed. Therefore, all primary school teachers who deployed in the preschools, they got the in-service teachers training. They included already.
And has that been uniform across the regions, or have you seen any variation?
Um, yeah, in some cases, for example, in the capital city, Addis Ababa, the enrollment rate for Addis Ababa is 100%, and 85% of the percentage share for the private sector is 85%. Therefore, they have qualified teacher, and in that cases, our intervention for enhancing the capacity of teacher is very minimal. But when we go to the marginalized region, like pastoralist regions, like Afar, Somali, and the other, we design, different teacher training system for them. We call it, for example, the first one, we call it Accelerated Teacher Training Program. It is a new program which is designed only for pastoralist community. And finally, at the end of the day, they will graduate by certificate level, but the program is sandwich program. 2 months they will be, before they join to the education system, they will get a 2 months training program. Then after they serve it for 10 months, again they will back again for in the College of Teacher Education. They will attend their 2 months training, and finally they will graduate by certificate level. That belongs for only pastoralist area.
Others?
So, Teresa, if I could clarify, I was curious to know that because of the struggles you're having with scaling, do you think that having something that was online versus only face-to-face could help you? That was really the crux of that question. Would that help you?
Do any of the training programs you have right now, how many of them incorporate online elements, or
Well, actually, in the Philippines, because the social worker are the supervisors and they do not have the pedagogy or supervising teacher, what we did is we had a blended one. We have face-to-face 1 week, and then they have the go back to their station, because the social worker in the Philippines are the right hand of the local executive. And so for another 3 weeks, they have this online, and then they come back for the final, which is another face-to-face. And they have at least 12 units at the graduate level. But the teacher themselves, we give a scholarship to them, and they enroll for 6 weeks customized enrolled in state universities and colleges, but we made sure that our curriculum, the ones that we have crafted, are also embedded in them, and that we are assured that they are used in the way. And so part of that is the use of the checklist. We have the early childhood, the ECCD in the Philippines have this checklist from 0 to 6, which the teacher has to really learn in order to find out if the kids have delayed or advanced or whatever for that matter.
And you have felt assured of the quality as you've moved to a blended learning.
Yes, because the teachers, those who really graduated from 4-year degree course, are also expected to be licensed. But when they are licensed, that's one more good problem, because the move, as I said, to the Department of Education.
I think for us, the community health workers, I want to buy that opinion and idea of having online courses, and we've done this in several other modules. I know we have a malaria, TB module that is online, and I think this has worked well with them. We were told we could get such engagements and partnerships on how to develop online courses for them, especially those that are staggered according to the modules. I think that will be key, because that has really shown that there's the opportunity of having retention enhanced. Yeah.
And I wanted to get to give you all a chance to reflect on this great question about, for you in your positions, is there some kind of technical support or assistance or community of practice? What would be useful for you all, especially just having had this experience of 2 days with sort of different country teams and learning from each other in an ongoing way? What would be useful for you in sort of the various challenges you're facing in everything we've talked about having to do with competencies and standards, training, monitoring, mentoring, quality assurance? What would be useful for you in your positions?
Well, I think pre-primary education, require some sort of innovative approach. In our cases, even this platform will have a potential to look out of the box and to design a new and innovative approach. For example, in our cases, with the support of development partner and also with the support of our existing platform, we deliver pre-primary education not only with one approach. We have four approaches. The four approach from the four approaches, three of them were we borrowed from other country, but we adapted, customized for the country conditions. For example, the first one is kindergarten program. It is originally it was solely responsible for private sector, and the government took some share, and the government also scaled up this kindergarten program at the government level. The second one program, as I mentioned earlier, O-class program. The third one, even O-class program might be very challenging to to provide early intervention through O-class, especially for peripheral areas, because it's very difficult to get qualified teachers, adequate resource, infrastructure, and the like. In that cases, we used a child-to-child program. And that child-to-child program also borrowed from other country, and with the support of this kind of platform, we deliver, the situations of our pre-primary education for all the stakeholders, and they come up with this solution. The fourth one is even child-to-child might be very difficult to get in some cases, because child-to-child program operated by grade 6 or grade 7 student for their siblings with non-institution based manner, and that means grade 7 or grade 8 student who after they end up their classes, they will go to their home, and the afternoon they will coach their siblings at village level. Even that kind of program might not implement at all levels, because in some cases we couldn't found a village who have grade 1 up to 8 school. Therefore, in some cases, there are villages who have only grade 1 up to 4 or grade 1 up to 5 school. Therefore, it's very difficult to enumerate, grade 7 or grade 8 student. In that cases, we used accelerated school readiness program. And that accelerated school readiness program means the student, before joining to grade 1, they will take some preparatory courses for 2 months. Then after they completed a 2 months program, they will join to grade 1. Therefore, this kind of program also we adopted by using the platform. And currently, we used the big platform. We call it technical working group at national level with the coordination of Ministry of Health, Ministry of Women, Child and Youth Affairs, Ministry of Social and Labor Affairs, and the Ministry of Education. Therefore, this platform also very helpful for us, not only to provide access, but also in order to improve the quality, like teachers development program, in order to develop even the new system for how can we improve school infrastructure and the like, how can we make it very inclusive for children with special need education and the like. We already just got a lot of information from that technical working group. Besides that, currently the 4 ministries: education, health, women and child youth affairs, and also Ministry of Social and Labor Affairs, we sit together and try to dig out where are we now in terms of providing quality, not only preschool education, but also quality early intervention program. And we evaluate each other, and every sector. Last year we conducted a large scale study, situation analysis. Then what we understand from that situation analysis, all those 4 sectors need to revise either the big policy framework, which encompasses all of the 4 sectors, and also the strategy we deploy each sectors. Therefore, by recognizing the result we found from the situation analysis, we currently revising the ECDE policy framework. Of course, previously we call it early childhood care education, but now we changed this and early childhood, not only care, but also early childhood development and education. And currently we are on the final in the final phase of developing that draft policy framework. And hopefully for the next months, we will develop second one, a strategic operational plan for the policy framework. That is, the sole responsibility of every sector, not, working by common, but every sector will develop that strategic operational plan. The third one we're supposed to do is we will cost out that strategic operational plan, and every sector will cost out how much it will cost for one child to give, nutrition aspect, protection aspect, and the early learning stimulation aspect. Therefore, we will develop that. Finally, Ethiopia is, a federal state, and we have, decentralized education system. Therefore, it is expected every region to develop their own context-specific costing model. Therefore, these all things are working together with the subsector, and R4D also have some part in Ethiopia. The staff from R4D also participate in this technical working group.
Great.
Yeah. I would say, Teresa, that there's the need. We already have a framework. Community health services is a framework for home visitors to be able to conduct their business in the required way. But there are a few other things that still needs support. For example, there's still need for continuous skill development through capacity building, be it through innovations, the use of digitalized kind of solutions in passing in this information and skills to the community health volunteers or these home visitors. There's also need for aspects of quality checks and also monitoring the activities through, of course, enhanced regular supportive supervision, where that encompasses both coaching and mentorship of community volunteers. Because of the nature of the engagement they have with these particular governments, they are volunteers, and being volunteers, then there's the duty and burden of responsibilities not really on them. So there's need for continuous support supervision so that they're able to provide quality services at that particular level. And then, of course, having platforms where there's peer-to-peer learning exercises, because ideally, if I will feel well if the whole country, Kenya, was embracing the aspect of nurturing care, and many counties doing the same. So it becomes easier. We could still learn from each other on some other challenges and how these challenges have been dealt with. And then there's the issue of supporting communication and, of course, publication of best practices on nurturing care, and also the better space of home visitors' work at community level, so that people are able to appreciate the kind of work they do there. And I know mostly some people might think about only seeing what is having immediate results, but not really looking at what has long-term impact results. Like, bringing up kids who are, of course, of the rightful nature, and then also the aspect of embracing partnership is still key for us in all aspects, so that we can be able to move forward the agenda of nurturing care in the rightful way. Through, of course, looking at how we can be able to retain and motivate these home visitors, how we can be able to make them feel part of this particular process and program, and also bringing in the aspect of how we can resource mobilize for this nurturing care program and home visitors program, and also doing joint planning in the sense that we could know areas that have issues and plan together in, of course, doing the interventions. Also, on a long-term basis, as an aspect of sustainability, embracing advocacy through supporting policy documentations, and also doing policy briefs for decision makers, so that we do have this nurturing care program sustained all through in the, and of course make sure that the home visitors are playing within a particular grid that can support their well-being, and of course also make the community embrace that particular aspect. The innovations are much welcomed. The use of ICT as a solution, as a local solution for some of these particular challenges is also key. Thank you.
Thank you, Kennedy. And I want to make sure you two have a chance to answer this question. And I wanted to emphasize what you think would help you in your positions to sort of advance some of these issues. Dr. Teresita.
Yeah. the issues of
in your position as executive director of the council, what would be helpful to you in terms of being able to, so Kennedy, for example, was mentioning case studies or peer-to-peer learning or collaborative learning. What would be useful to you in sort of the common challenges we've been talking about? If you could pick something that would be available to you as a resource, what would you pick?
First of all, there's a real need for the government to really come up with a way to compensate the worker. That's one, that we are working. Two, I've learned from this conference, and I'm very thankful for it, that there is a need for branding the ECCD, because it will make them attractive. Like a live show that will feature the way that they are helping. They're helping the families. Two, the use of parents as mentors. If they are able to come to the classroom and see, and then they can augment. Let us accept the fact that not all children can be can be accepted in the center. For example, in my case, there's a 10 million universe from 0 to 4. And only, I'm not sure if this is 50% of that is in the center. So we have got to use other volunteers. And the volunteers should really be trained. So that's that one. I have learned a lot. So what we did is really, and I think I would increase that, is to come up with micro teaching videos where the teachers, after the training, are given these videos so that they will be able to do it in their own classroom. And I think if we can have an online for those who are undergraduate, then an expanded kind of equivalency program, then perhaps they will be able to complete their degree, and the government will listen. That's one that we are trying to find out today.
Okay.
And I've learned a lot from this conference.
Great. And Nayana, you have the last word.
Yeah, can you just repeat the question? Because
so the question was, what in your position, what would be most useful to you if you could ask for some kind of resource in your, sort of your daily job dealing with policy, practice, how to bridge the gap, the common challenges we see. What do you sit in your office and wish for?
As I said earlier, now we have introduced the early childhood care and development policy, and also the preschool policy. There is a policy for child protection, and also a policy for the daycare center policy, and also we have established guidelines for the daycare centers. All those documents are there. But while now we have to implement that policies and guidelines. So now we started the developing a curriculum for the preschool teacher development courses, that is the professional course. So, and also recently we started the curriculum framework for the preschool children. In that process, the most challenge that we faced is the lack of professionals for such kind of activities. If we take Sri Lanka, there are very few professionals, so we have to get their services to everything for the teacher curriculum and also for the preschool, the children's curriculum everywhere. While that curriculum that is placed, we have a problem of the training teachers, and if we take the preschool teacher professional curriculum, that the professionals that who are going to teach that problem is there. So I think the most the challenging thing is to get that professionals to the system. So if I can get assistant from anywhere for that assistant for the training of trainers within the country, that is the most the expected one from my side.
So a larger pool of experts.
Yeah.
Right. Okay.
And also for research. I think we lack research in this field.
Okay. All right. Well, thank you, all of you. Thank you so much for coming and being willing to share your expertise with us the past several days and this morning. It's rare to have the experts in the room willing to give us their time and energy. I know there's a lot waiting for you when you get home. So thank you very much.